Hi, good morning. I'm Mehdi Shishehbor. I'm an interventional cardiologist and the president of the Harrington Heart and Vascular Institute here in Cleveland at University Hospitals. The aim of this study was to evaluate the safety and the efficacy of the Chocolate Touch balloon, a second generation drug-coated balloon, versus the first generation Lutonix DCB, which was approved as the first DCB balloon over 5-6 years ago. Yes, the Chocolate Touch DCB is a special balloon. It's a second generation drug-coated balloon, especially because of some of its structural features. Unlike traditional balloons, which are just a balloon by themselves, the Chocolate Touch has two components. It has a balloon, but it also has a nitinol cage that creates grooves and pillows within the balloon. These grooves and pillows allow differential dilatation, and that differential dilatation is what we believe leads to lower dissections and less vessel trauma. It also allows a higher surface area for drug delivery, about 20% higher surface area because of those grooves and pillows, which is very beneficial when you're trying to deliver drugs. Yes, this was a randomized clinical trial with core lab adjudication and a CEC, independent CEC. Patients were randomized 1-to-1 to Chocolate Touch and to Lutonix DCB. The follow-up is obviously up to 5 years. We are presenting the 12-month data at ACC. And the primary efficacy endpoint was primary patency, which was defined as having a peak systolic velocity of less than 2.4 without a clinically driven target lesion revascularization and without the need for bailout stenting. One of the limitations of prior randomized trials of DCBs have been the fact that many of the patients required bailout stenting, but they were still considered a success with DCB. We believe that when you take a DCB approach, you shouldn't be needing to put a stent. So we wanted to truly assess DCB success. So we counted bailout stenting as a failure. Fortunately, none of the patients in the study in both arms had bailout stenting. So at the end, this did not become a factor, but that's the design and the definition of our primary efficacy endpoint. The study was very interesting as we are presenting the 12-month data, and what we showed was that Chocolate Touch was non-inferior to Lutonix DCB at 1 year for primary patency of 78.8% in Chocolate Touch and 67.7% for Lutonix. But importantly, because we met the non-inferiority primary efficacy endpoint, we tested superiority, and Chocolate Touch was superior to Lutonix DCB at 1 year for primary patency. Regarding safety, both devices were equal, and there were no differences from the standpoint of safety endpoint. I think the take-home message from this trial is that as we evolve and define and innovate with second and third generation devices, we need to head-to-head clinical trials that can assess efficacy and safety. In this case, the take-home message is that second generation Chocolate Touch DCB obviously was superior to Lutonix DCB at 1 year with better efficacy and similar safety profile. There are obviously features of the Chocolate Touch, as I mentioned earlier, that make it unique, and we are interested to see how the results pan out over the mid to long term at 2, 3, and 5 years. Absolutely, as I mentioned earlier, this is an ongoing clinical trial of up to 5 years. So we will continue to monitor these patients with the duplex ultrasound and obviously clinical follow-up. Interestingly enough, the study was conducted through difficult times. There was the paclitaxel mortality association, which was defined in 2018, 2019, which resulted in a 6 months hold in the clinical trial here in the United States. And as you know, there was the pandemic, which really made it challenging to conduct clinical trials in the last 2.5 years. But despite all the challenges, we have had 94% follow-up in this clinical trial, at least at 1 year. And we are hoping that we continue that level of follow-up as we move on to second, third, and beyond. I'm very excited that, as you know, in the field of cardiovascular medicine, and especially in the field of vascular, there are very few limited head-to-head clinical trials where we are comparing one device and against another device of second generation versus first generation. And I'm excited that we were able to embark on this. I'm also very grateful to the international body of investigators and patients that committed in the hard times to do this trial, and just fortunate to be presenting this trial, and look forward, as I said, to the mid and long-term results in the future.